The PC. I'm going to make predictions. Next year, when I ask that question, it'll be reversed. And in 3 years, when I ask that question, PC. I switched to Mac about 3 months ago. And it's like having a baby for 3 months. It was terrible. But now the baby is kind of laughing and smiling and walking around and hugging me and loving me. It's wonderful. So if you're interested in switching, be prepared for a little discomfort. But then it'll be lovely. Javi?
Ready. Thank you very much, Don. Okay, we go on board of the train. It seems to be fantastic. I love train.
Yeah.
Great. Why plastic surgeons are talking about non- and mini-invasive surgery procedures? We have several reasons. The first reason is 94% of the human beings would like to carry out some changes or improvement on their body if they were brave or dating, but 80% would accept it would be non-invasive or mini-invasive surgery. This is the first reason. The second reason is some time ago women stayed at home, but now they're working, they can't be off of work. The third reason is a world financial crisis, and people are not able to spend money. And long operations, as Dominic said, anesthesia fees, if you have a hematoma, you go back to the operating room, increasing the fees. The problem is that we need to look for how to avoid the expensive fees, because the patient will cost a lot of money. Another reason is, well, in the American Society, they show that the surgical procedures decreased in 2009 17%, it's quite a lot. And the non-surgical were increasing, imagine 9%. If we see how many face surgical procedures was done in 2009 in the United States, 125,000, if we compare with the non-surgical procedures, it's 8.5 million. It's not comparable, it's incredible. And 6 out of every 7 patients accept the mini-invasive procedures. Only one decide an aggressive facelift. What are the patient's steps when she wishes to rejuvenate the face? Well, the first step is shopping. Ladies like shopping. And they buy and shopping, and they buy the creams, the cosmetics, because all the cosmetics offer lifting, the word lifting. And this is the first step. The second step, the dermatologist is selling creams too, and is infiltrating and is doing a little bit more, or the cosmetic doctor, because have Botox, laser, fillers. And the last step are the plastic surgeons. Why? Because, my friends, we are cutting, we make bleeding. And many patients are afraid of us because, you know, we look for them like Hannibal Lecter. We are killers. We are killers. What was the first mistake plastic surgeons made? That was the first mistake. First mistake was that we were involving the more simple flap, just the skin, involving more deeper structures, more muscles, a smash, more flaps, more aggressive. We were performing, and we have been performing aggressive facelifts because it was the only solution to get a fantastic result, and very aggressive. But why? The question is why? We wanted longer lasting result. And this was the first mistake. Because in 2009, of the gurus of the face rejuvenation, Daniel Baker, Sam Hambra, Osler, Ramidi, they show us that despite any technique we use, more or less aggressive, after 5 years, 6 years, patient need another facelift. Patient need another facelift. 5, 6 years. It doesn't matter. The most aggressive extended mastectomy, doesn't matter. Patient need another facelift. This was the first mistake. And the surgeons were performing and were experts. We know is right. Patient need another facelift after 5, 6 years. The second mistake. This is for me the most stupid mistake we make plastic surgeons. You know, long-lasting result. Somebody's coming and says, Javier, it's long-lasting result with this procedure. How long-lasting? Long-lasting, long-lasting. You know, the thing is, imagine how intelligent we look when we say long-lasting results. If we buy a BlackBerry, are you asking for a long-lasting? Tell me. No, you ask for the facilities, what you can do when you buy a laptop. Do you imagine 10 years using the same laptop, long-lasting? Come on, there is any lady here who buy a pair of shoes for 10 years, long-lasting? Can you lift a hand, somebody? Or just a men too, or a dress code? Come on, long-lasting. No, it's stupid. This is stupid. You know, and we are happy, long-lasting. Come on. The thing is, by the other hand, we try in our office, to organize, you know, epilation, the statisticians coming and working in the institute, anti-aging, selling creams, many things. Why? Why? Because what we are trying is to fill our waiting room, to have a lot of patients. This is what we try. Can you imagine long-lasting? You know, can you imagine the patient say, doctor, how happy I am, I will come back in 2025, bye-bye, bye-bye. It's stupid. This was the second mistake. We want to suicide the plastic surgery. Anyway, we have been involved in this mistake. When the word long-lasting, it's important. Yes, yeah, it is important when? When the patient pay high fees because there is a long operation, 2 days in the clinic, if he has a hematoma, and when the post-op is too long, 1 month and a half, 2 months, without getting out from the house. Yes, you can tell the patient, okay, in 2 years I will do a maintenance. They say, oh, come on, no, doctor, 2 months more at home is not possible. Do you see this patient? Of course, this is a patient that she will ask for long-lasting because it was 1 month, 5 weeks at home. Yes, this is the only case that people ask for long-lasting. From the business viewpoint, okay, you know, I get my income because I'm operating, I'm surgeon, I have no other business. Then if the patient have good memories, the patient will be satisfied, and the patient will ask for more operations, and the patient will bring you more patients and more friends, definitely. But if the patient have bad memories, and bad memories is not your fault, bad memories is hematoma, bad memories is long post-op, and finally the patient think it's your fault, it's our fault, because we are the plastic surgeons who said, now come on, you will look fantastic in 2-3 weeks, and it was not true. Okay? And then patient will not ask for more operations, and definitely is not going to send you anybody. Definitely. We show nice results. Oh yes, we show nice results always in the meetings. Oh, this is my technique, I do that, look at the patient, it looks great. Oh yes, the neck, the technique, the smash, the platysma, the flap, higher vertical. Yes, we show fantastic results. Yeah, how great! Oh, we are fantastic surgeons. Yes, but the problem is this the truth? No, it's what the topics told you. Look at the patient. I pay a price for this result. The price was yes, swelling, lymphatic drainage at home, complaining. Okay, and sometimes, as you saw it, yes, hematomas, and 1 month, 1 month and a half, 2 months, without going out, no social events, no working, and complaining every week, doctor, but I came to you because I was planning to look better, you know, and this is the truth, and this is what normally we don't show, we don't tell. And if there are surgeons who say they have never had complications or never injury hematoma, are either not doing very much surgery or have a highly selective memory. And this is the reality. If we are honest in front of our patient, if we are honest, we say, and I have been performing in front of my patient, no doctor, I don't want threads, or no, I want a facelift. Okay, okay, do you accept the possibility to have a hematoma? Oh my God. Or you want to look like this at the same time? If we are honest, the irregularities, you know, the hardness, hematomas for 1 month and a half, do you accept it? I have no guarantees. It is possible. Or you want to look like this? Or, yeah, 6 days after the surgery, you want to look like this or like this? What do you prefer? There is no doubts. Everybody, me too. This is what I am asking for, doctor. This is what I am asking. So, my friends, the market of the aggressive facelift is very sick. And maybe in the next future, all the surgeons, plastic surgeons, we will take to the cemetery because the market will die. And I don't want more hematomas. I don't want more visible scars. I don't want hair problems. I really don't want asymmetries and pigmentations and low sensitivity and lumps and hardness and facial palsy. No, definitely I don't want. What I am, I wish is really for my patient short surgery, to have a nice look soon, few days recovering, and happy patients. This is what we call the non-invasive facial rejuvenation techniques. What is the face evolution? And this is endoscopic forehead lift, silhouette sutures, botulinum toxina, and fillers. And the silhouette sutures, if we compare with the cardiac surgeons, when a patient had, to remember, an angina, and it was a bypass, an open surgery, 3 days in intensive care, 1 month recovering, and now they have the stent. The stent means 24 hours, and the patient go back to his work, and working again, and normal life in 24 hours. We think that really the sutures are the stent of the plastic surgery today. And this is what we go to talk today, what is the global facelift pack, that is the silhouette sutures combined with toxin, botulinum toxin, fillers. Also, we will add buttocks, not because some faces look like a buttock, sometimes yes, but it's because it's an interesting procedure to see today. Okay, thank you very much for the attention.
Okay, now, are we ready to go to the operating room, Javi?
Yes.
Huh?
Christian.